Atrial fibrillation is a heart rhythm abnormality, or an arrhythmia, and it starts in the upper chamber of the heart, where instead of the natural pacemaker of the heart giving off a nice regular 70 beats per minute, the other areas, electrical areas in that heart take over, putting out up to 600 beats per minute. This then goes through the heart switching station called the AV node, which doesn't allow all 600 beats per minute to come through, but often results in a very fast heart rate with heart rates in the 120 to 180 or even higher beats per minute. This can obviously be very uncomfortable. Atrial fibrillation can be termed as permanent, meaning somebody goes into it and stays in it, or paroxysmal. Paroxysmal means that it comes in spurts or bouts, which may terminate or end by themselves, or may require medical treatment. Atrial flutter is a heart rhythm abnormality, or arrhythmia, that originates in the upper chamber of the heart, or the atrium. In distinction from atrial fibrillation, which is a very irregular and unorganized heart rhythm, atrial flutter is an organized but very fast heart rhythm that originates from the atrium. It's where the heart is, the atrium is beating at 300 beats per minute, but in a regular fashion. So patients with atrial flutter often have the exact same symptoms as patients with atrial fibrillation, with the fast heart beats, or sometimes irregular. But they also can have, fairly regular heartbeats and may have normal heart rates. Treatments are fairly similar compared to atrial fibrillation, and these individuals, we used to say 10 or 15 years ago that they, because it was a more organized rhythm, that they were not at increased risk of stroke, and we didn't routinely put them on blood thinners. We now have recognized that people with atrial flutter are at increased risk of stroke and probably have some atrial fibrillation mixed in with their atrial flutter, and so therefore we recommend treating them with blood thinner as well. Some people with atrial fibrillation have no symptoms whatsoever. That is either because they're tolerating it very well, even if they have high heart rates, or some people with atrial fibrillation actually have normal heart rate and therefore have no symptoms. But most people with atrial fibrillation have some symptoms. This may be palpitations or a sense of an irregular or fast heartbeat. It may be some lightheadedness or breathlessness with exertion. So they feel good sitting around, but once they stand up and move about, that heart rate of 160, 180, just walking across the room, is uncomfortable. And unfortunately, some people don't have symptoms until fairly late, like that they have been in atrial fibrillation for quite some time, and they may develop heart failure symptoms or stroke. So it is important, if people notice a change in their heart rhythm, to seek care, because the symptoms in atrial fibrillation can be subtle.